I'm delighted to welcome you to the Common Hour today, and it's my great pleasure to introduce a joyful, creative daughter of F&M, Dr. Joan Fallon, class of 1979. Dr. Fallon is a scientist, an educator, an entrepreneur, and an innovator whose passion is for helping children and families. She is the founder and CEO of Curemark, LLC, a cutting-edge biotechnology company based in Rye, New York, that researches, develops, and markets products designed to improve the quality of life of children and adults living with neurological disorders. Some of those include autism as one of the major points of focus of her early work. Her story, and the story of Curemark, which we'll hear about today, is a wonderful example, inspiring example of how to use liberal arts education as a springboard to problem solving that has tremendous social impact. Just Tuesday, I traveled to New York City to join Dr. Fallon's family to see her receive the annual honor for visionary entrepreneurship from the organization Springboard in New York City, which is dedicated to accelerating women-led businesses and supporting a culture of entrepreneurship among women. At Franklin and Marshall College, Dr. Fallon majored in biology, minored in government, and had a minor in squash. She went on to receive her DC degree from Palmer University and worked as a pediatric chiropractor for 25 years. She's taught anatomy, physiology, developmental biology as an assistant professor at Yeshiva University and lectures around the world on pediatric development. In the late 1980s, Dr. Fallon began treating a number of children with autism and other developmental disabilities through her practice. As her pediatric specialty grew, she recognized an emerging pattern among children she was treating who had disabilities. They had trouble digesting protein. She tested her patients and found that a number of them had low levels of a particular digestive enzyme. And when she began treating certain patients with replacement enzymes, she noticed cognitive improvements. There's lots of technical terms for that, but I call that using your Franklin and Marshall education to solve a problem. By 2004, Dr. Fallon held 4 patents pertaining to her treatments of children with developmental disabilities, including ADHD as well as autism, and she founded the company Curemark in 2008. In 2010, Curemark received an investigational new drug authorization from the U.S. Food and Drug Administration for its treatment of ADHD, and the company recently announced it's begun a rolling submission, it's called, of a new drug application at FDA for a treatment of autism with the enzyme replacement therapy that Dr. Fallon discovered. The application, and this sounds technical, but each step is crucial to bringing this therapy to children, and that's what it's all about. This application was granted a fast-track status, very important, by the FDA, given its potential to treat a serious disability and address what is currently a massive unmet medical need in our society. And Curemark recently completed what is called a phase 3 clinical trial for its autism treatment. Dr. Fallon's discovery, the identification of a biomarker for autism in many children, and the subsequent development of treatments speaks to the power of a liberal arts education. I'm so pleased that we'll be able to hear from her today and to hear her thoughts on the art of disruption. Please join me in welcoming Dr. Fallon to the microphone.
Disruption. I think it's a word that gets thrown around a lot out there now because of Silicon Valley and all this technology. But I'm going to frame it a little differently for you today. I'm going to give you some ideas about how I look at disruption and about how disruptive thinking and disruptive potential, where it exists in our lives, and a little bit about how this education really can help with that. So, the classic thinking about disruption is that there's a status quo and something comes along and changes that status quo. puts us in a new place, and develops a product or some kind of new thing that is new thinking. And the reality of it is that I don't really think that's exactly how it happens. So Christensen wrote The Innovators Dilemma. He talked a lot about disruptive and disruptive thinking and about what happens during disruption. He talks about it bucks traditional technology that doesn't work so well. You know, it's usually cheaper, smaller, and more convenient, although I don't agree with that completely, because there were certain things that were disruptive along the way that weren't cheaper, smaller, or more convenient. They actually caused more problems. They were first adopted by a small segment of the population, and for sure, funders definitely don't like them. Things that are different, people don't usually want to put money at. I did a briefing at the White House talking about the difference between the life sciences, where I work, and the Silicon Valley disruption and technology, and how in Silicon Valley, if someone has an idea, an app, a fleeting thought, people are throwing money at it. But in the life sciences, people don't do that because you have a regulatory authority. That even if you have something that's really cool and it really works, the regulatory authority can say, you know what, this is too dangerous or too risky, or may have too many side effects. So there's a regulatory authority that oversees that. So there's lots of issues around disruption. So let's take a look at this. Right? Do any of you young people know where that's from? Okay. All right, so this was a part of my world growing up, and probably Dan's world, et cetera. It was really about Tower Records. Now, Tower Records was a hugely established, it would be like the, iTunes store today. It really was the iTunes store of today. And that's where you went to get everything. And it survived the transistor radio. It survived the reel-to-reel. It survived 8-tracks. It survived cassettes. It survived the CD. It survived the Walkman and the Discman. This is all what we lived with. But it couldn't survive this. Right? It couldn't survive the iPod. And it's interesting, when the iPod first came out, it had a major, major, major flaw. Something that was very different than anything else. First, the digitized music, right? The CD really digitized music, so that was really cool, because the quality was great. But there was something about the iPod that was different from all these other things, especially the early ones. Do you have any idea what that was? You couldn't play it out loud. You couldn't play the iPod out loud until all these peripherals were developed. So I'm having breakfast. I have 2 colleagues here with me. I came this morning, I played squash. I went back to change. We're having breakfast. And all of a sudden, Tower Records comes into the conversation in the background on television. And one of the people that was there talking to Kathy Lee, I guess, or someone, said, you know what? You can't smoke pot and go to Tower Records anymore. That's what I did when I was a kid. So it's exactly right, that generations change and things change. So as people talk about classic disruption, this is from a group that calls themselves Disruption. And it talks about asking questions and challenging conventional wisdom and overturning assumptions. And indeed, that's exactly what happens. But I'm not convinced necessarily that that's where it comes from. I'm going to argue that that's not at the heart of disruption. I'm going to make a completely different argument. Here's your classical thinking. Status quo moves along. Something comes along to disrupt it. What I'm going to propose, I'm going to call it Jone Thinking for today, is that there are spaces within the status quo that already exist. And it's within those spaces that the disruption comes out of. And so as I think about it, that's kind of how I conceptualize it. Because there are things that are not necessarily, that don't always make sense to us. But because we accept the status quo, we just let them go along. But it's within those spaces that I believe disruption happens. And I believe within the status quo, there are multiple areas or multiple spaces. So let's look at these bricks, right? These bricks, you put them together, you could actually push them over. They're a pile of bricks, right? But you take spaces in between them, and you put something in there, and it makes a wall. This is not strong. This is really strong. It makes the coalescence of those bricks a very strong wall. As I was putting this together and thinking about how to bring my sort of conceptualization of this to real life thinking or a talk, I remembered that when I was a freshman here, my roommate and I teased these two guys down the hall mercilessly. They teased us, we teased them. It was a constant back and forth. Well, they ended up winning, because you know you have Hartman Oval, Hartman Green out here? Well, that was Hartman Hall when I came. I came in September. That graduating class in May was the last ones to be there. So they were dismantling Hartman Hall. So one Saturday morning, we woke up to find that all of the bricks from Hartman Hall were in front of our door. That we were completely bricked in, and that the whole dorm had helped our friends. So I think that our joking stopped at that point. But the strength of that is in the spaces. So you look at this, right? What is this? The San Andreas Fault. It's a fault. It's two pieces of land, and I don't mean to insult any of the geology people. It's two pieces of land with a space in between, right? Where does the disruption come from in that fault? It comes from the space. The land gets disrupted when there's an earthquake, but it's the space in between from which the energy comes. And we can talk about entropy and enthalpy and organization and disorganization and all those concepts, but all of that has to do with the space in between. So I looked at the definition of space. We think of outer space, personal space, all kinds of space, but the space is where everything exists. And I thought, well, that's an interesting concept. That's what space is defined as. And then I went to look and see did anybody ever look at space before? Well, sort of everyone's looked at space. Gauss and Leibniz and Einstein and Newton, their entire lives as inventors, as mathematicians, as, all the different metaphysicians like Leibniz, it was all about space. And how do you define space? Is space the place between two objects? Is that object defined? Does it move? Is it one object? Is it one relative to another? We know Einstein talked about the relativity piece. So everyone studied space. Newton looked at it as gravity, the direct pull between two places. But space has been something that sort of the philosophers and thinkers and scientists that have gone before us have thought about. So I'm going to look a little bit at disruptive positioning as I think about it. So when we think about an object, we think about it as being in position, or what I call just a position, right? So it's a thing in space, it's fixed, it has singularity, there's no combinations, it just is what it is. You can describe it, but it's got a fixed point, right? And it's stagnant. It doesn't necessarily move, even if it's moving. If it's fixed in a place, it's right there. And it's not necessarily idea generating. It's what it is, and you can think about it and conceptualize it, but it's just one thing. And then we put together something that I call juxtaposition. That the juxtaposition of things actually creates the space in which disruption comes out of. So there are two things relative to one another, correct? And they're fluid, they could be moving relative to one another. You could have the same distance between two things, but they can be moving. And there's all kinds of qualities, varieties, combinations. You get more than two things next to each other, and you have combinations, and you can arrange them in different ways. And you have growth, and what you do with those things can be very idea generating. So I'm going to argue that the space where disruption comes is when you juxtapose things one to the other rather than just looking at one thing in space. And that the status quo that we live in, and we can apply that in the sciences and the arts and the humanities, doesn't matter what it is that we're looking at, if we look at one thing as itself, it doesn't necessarily give us that space where disruption or creativity happens. So we have a lot of things like that. This is one of my favorites, Archimedes Paradox. So if you take a pebble, you can take 1 pebble, 10 pebbles, 1,000 pebbles, and you throw them in the ocean, they sink. Boom, go to the ground. And you do it over and over and over again, right? And then you take a big battleship, and it floats. It floats. How could that be that you can take a pebble and drop it in the ocean, but the big boat floats? If you take a rivet out of that, right, it sinks. You take too many rivets out of the big ship, the whole thing sinks. But the reality of it is, how is it that you can throw a pebble in the water and you can have a big ship? And this is the biggest ship in Hamburg, Germany, that's being built. Why is it that it floats? These are the things that great philosophers and scientists have looked at. But if they didn't look at that floating versus sinking issue, and how do you get something that, you know, if you take 1,000 pebbles and you drop them in, either all together or one at a time, they sink. But if you put them on a ship, they float. Those are the kinds of things where someone who looked at that very carefully, looked at that paradox and said, wait a minute, there's something in there. So I'm going to go through a couple of those, you know, those things that happened in my life that made me embrace those places. So in my last life, I was a doctor. I saw children. I did a lot of pediatric development. And I'm in New Zealand. And the head of the school there said to me, I need to go see this child in the hospital. So I give a lecture all day. He and I go, we have a dinner with a group of people, and then we go to the hospital. And I see this 9-week-old child with failure to thrive, meaning they just they weren't developing, they weren't going to develop. So I looked at the child, and I saw all kinds of things. She was listless, she didn't suck, she didn't move her limbs, her eyes didn't open, she was hospitalized since birth, and I was looking at this child who basically they said was never going to develop ever. And in fact, she could probably die because when you don't move, you have lung trouble and there's all kinds of things. So she was called failure to thrive. But then I looked at her chart. And Larry, you're going to appreciate this. I looked at her chart, and she was born at 41 weeks, so she was not late or early. She was normal weight, so she wasn't what they call light for date. Right? Her EEG was normal. Her APGAR score when she was born, which rates sort of how well you're breathing and your color and everything, was totally fine. All of her medical things were normal. And I thought, how can this be? How is it I could be looking at this child and reading this chart and saying, wait a minute now, there's something else going on here. So and what I talk about is embrace that paradox and said the answer for this child may be is somewhere else. It's definitely somewhere else. I don't know that I'll be able to find it, but it's definitely somewhere else because it doesn't exist in what I'm looking at next to this medical chart. I mean, everything was normal. So as it turned out, I embraced that paradox, as I said. I knew it had to be somewhere in between. And lo and behold, this is a normal skull of a child. And you can see where the blue is. Those are what they call the soft spots, right, in the skull of the child. It's very cartilaginous, it's soft, and then there's soft spots. Well, in this child, and I use this as an illustration, there weren't a soft spot there. They were not there. And indeed, the child had what they call scaphalocephaly, and with a cranial synostosis, but because it was only 9 weeks old, it wasn't completely fused. So as I started to feel the top of this child's head, which was elongated, and I went like literally pried open, I just went like this with my hands, because remember it's cartilage, it's like your nose, it's softer. she started to suck like that. And indeed, she had this fusion. It compromises the brain growth. And as a result, they snipped the suture, they opened up her brain, and she's fine today. But they were willing to just say, I'm looking at this child, doesn't suck, doesn't open its eyes, it had a feeding tube. This child's never going to be okay by 9 weeks. But in reality, no one had looked at what the problem was. And that happened twice to me, the same kind of problem. This was the first one, and then another one in my practice where a child had a very unusual one, which is an occipital fusion, and she had tremendous, what they call status epilepticus. She kept seizing. And it turns out that's what the problem that she had. And so by looking at, you can't always look at something and recognize that it's just what it is, just what you're seeing, or just what you're reading. Because if you read that file, you say, this is a normal kid, this kid's gonna have normal. You had to look at the paradox, and in that middle was the answer or the disruption or the change. And so I did the same thing with my company. I mean, I didn't start out to form a company. I didn't start out to look at something that was different. I was seeing children with autism in my practice, as Dan said. And as I'm seeing these children, they're coming in with these variety of symptoms. And there are specific core symptoms of autism, like a lack of socialization and impaired speech. But there was great variation child to child. So for example, some children wouldn't look at you at all. Some children would look at you a little bit. Some children were more social than others. Some had no speech. Some had intermittent speech. So the core symptoms were not the same. They just were different child to child. But they all had impairments in those areas. Physicians were doing all kinds of what I call crazy things. They were doing chelation and all kinds of things that were generally dangerous, but parents were so desperate because there was no standard of care. So they didn't have to adhere to anything. Their peers weren't going to say, oh, that's crazy. You can just do whatever, because there wasn't anything for them. There still isn't a standard of care pretty much for these kids. But when I was seeing them one after the other, what I found was that what they ate, for the most part, was more similar child to child than their symptoms and their core symptoms. And I thought, wait a minute. There has to be something about that. Just like the kid with the two pieces, the two looks, same thing here. So I thought, okay, what do these same diets look like? They didn't have protein in them for the most part. They were devoid of protein. So I thought, well, that can't be by chance. Maybe I need to pursue that. So just very empirically, right? I've got these kids coming in every day, practice, and did blood and urine and stool on a group of them, first 9 of them, and ultimately found that the kids with autism had, in the blue, low levels of a particular enzyme that digests protein. And the kids who didn't have that were normal, the red. So I looked at the difference between what I was seeing and also, in this case, what I was being told by the professionals. The professionals were saying to me, they just don't like the sensory feel of the meat in their mouth. And I thought, that's the most ridiculous thing I'd ever heard. I know they have sensory issues. In fact, sensory issues for children with autism are more problematic for them than even their lack of speech. So for example, if a child goes to dinner, if they don't like the loud noise or the lights in the restaurant, they can't stay there. But they can stay there if they don't speak, right? So these sensory issues were really important and prominent, and I really got that, but not to the point where that's not what they ate. I kept saying it was too similar child to child. It was almost, in the medical world, they call it syndromic. It was almost a syndromic piece. And so, indeed, that's what we patented. We patented a lot of other things since then, and now have a whole company around treating these children with an enzyme because it's low level here. So, because I looked in between the spaces, that's where it was. So I think there's really a process to this. It's not sort of something out of thin air or that it comes out of no place. But I think that first, you have to look at the seams, because there are seams in the status quo. So I'm going to go back to sort of the disruptive piece. When the internet came on, the commercial part of the internet that you could get at home was called CompuServe. Probably most of you have never heard that word. But that was the thing. And you could actually have an email address and talk to other people. Not with instant message or anything, just email. And that was cool. And then AOL came along. And AOL was majorly disruptive because it was an ISP that lots of people used. And why did they use it? Because they mailed it to you in the mail. They sent you a disk in the mail, literally. And that's how you downloaded AOL and you put it in your computer. And then magazines had AOL disks. Imagine that, going and buying a magazine, there's an AOL disk there. But AOL had news content and other things in it. And so you could get instant information from AOL. But AOL went down all the time, had all kinds of problems with it. But it was better than the status quo, which was not being able to go online and look at something or look up something. So you sort of put up with the flaws and the imperfections because it was different and new. And it took time to evolve. And then, of course, it's not the major one anymore. Different models came in, different refinements. But getting news content and understanding that you can go onto a central place and you can email someone and say, hey, did you see this? That's how that evolved. When I was a student here, we had to do programming as part of our math curriculum, and part of the science curriculum. We did some programming, basic, Fortran. I know those languages are like archaic. But you'd have to write the program, and then you would go and run it. And the lab was over in what's now the Harris Center. And if the program came out thick, you knew you got it. If it came out thin, it bombed. It didn't work. And that's how this all evolved, right? Those are the things that, Bill Gates did, right? That's how he did his work initially, how he got those 10 years in from the Outlier book, right? Those 10 years into understanding what that's about. So things have changed so much, but they came within those spaces. So if you observe the spaces, then you'll see where that disruption comes from. And then you can juxtapose things one to the other. And understand when something doesn't make sense to you, there's something else in between. And then you embrace that paradox. And when you embrace that paradox, you got to go for it. And you'll find the space, you'll find the place, you'll understand what's in there. But accepting the norm, the status quo, is not going to be the creativity and the disruption that we all long to have and to be a part of. And disruption occurs everywhere. It's not just in sciences. We think it's, science or computer or tech. But disruption happens in all these different areas. In the arts and the humanities, literature, things come along, and it's disruptive because someone saw a space in there. So I'm going to look at this in context of your liberal arts education. And I think that in retrospect now, when I look back at my educational process and what a place like F&M afforded me, it's more valuable than anything else that I have ever had in my life. My graduate school education allowed me to be in that sort of narrow area here, that yellow piece. But I hearken back all the time to my liberal arts education as that broad place from which you look at multiple disciplines and understand what other people are doing in the world. When I was a student and when I got out of school, I used to read the Times, there wasn't Craigslist or LinkedIn. You read the Times want ads. That's where you got jobs from. But because I was so science-oriented, I didn't even know what other people did in the world. I had no idea. You're a business major, you're going out to the world. I had no idea what you did, what kind of jobs there were. So just to sort of educate myself, I would look and see, This is what the kind of jobs people are doing in finance or in advertising or something. But the liberal arts education really allows for that broadness and to understand, multiple disciplines at the same time. If you go into that narrow space, you have a deep expertise. But what I'm going to argue is that as life goes on, like even today for me, in the real world, you can apply that liberal arts education as a very large umbrella. And you can put other pieces underneath it, right? So you can take that liberal arts education and you move it around, and underneath it, you can put all of these silos, the depths. So I run a company, right, where you need deep regulatory understanding, deep basic science, deep finance. I don't have that background, right? I have the science background of a particular kind, a clinical, because that's the direction that I went in. So now I have enough understanding to know what I need to execute in this company. What do I have to get? What is the expertise I don't have in order to put it under the umbrella of who I am and make this company run well? So I'm going to argue that the liberal arts education gives that to you because you're young and you absorb all kinds of things from this education. If you went to engineering school and then try to get a liberal arts education later on, can't do it. You can't go the other way. You can't do that. It's a very different thing. You can come up and go like this, but you can't go this way. You can't get that umbrella the same way you can while you're here at this time in your life, at this age, in this place. And so if we look at all of this together, the liberal arts education allows you to embrace the spaces within disciplines, right? And between disciplines. Not just within your discipline, but between disciplines, where there's lots of integration that can happen. So as we're having this discussion today, if we looked at all of the different things that we covered, we looked a little at engineering, right? We talked about faults and geology and clinical science and biology. We embraced all of the various disciplines that can come under the umbrella of a liberal arts education. Philosophy. So liberal arts education is very, very important. Very important to your way of thinking later on. Let's say you're headed for law school. Law school gives you a very specific way of thinking. If you were going to law school today and then studying law the way you would maybe in a lesser sense, and then going again to law school, your thinking would be very much in one direction. But you have this liberal arts education, and then you're going to think about science, or you're going to think about law. You're able to then apply all those pieces, all the spaces between those disciplines, to help you do what you do in that very deep silo that you decide later on. So I look back at my liberal arts education and say this was one of the most important things that I've ever done. This place gives you probably one of the most unique opportunities because it's so strong even in silos, but you have that bigger, broad perspective. So as far as I'm concerned, you get the best of both here. And I think it's really important if you're looking to be a disruptive. Why is it that, all of these disruptors, Steve Jobs, Bill Gates, all of these guys dropped out of college? They saw the spaces. They negated other pieces in their life. And indeed, I think right now, the Gates Foundation suffers from a lack of over perspective. They're deep in the silos. They hire people. They put people under there. But they need a more global perspective, and which is what they're trying to do right now. Because they need to understand that the innovation doesn't come from the same old thing. It comes from something different. So if you're applying for a grant somewhere and the people who are reviewing it are status quo type people, and they're not looking at the potential for disruption, you don't get funded. So the innovation and the way that you think is really important going down and into your future. So to conclude, and because I'm sure there'll be lots of questions, and I love questions and an opportunity to really get into something when we have questions. I'm going to say that the inspiration, the focus of change, disruption comes not from the departure from status quo, but from the spaces that are within there. Thank you.
As we open it up to questions, I just want to remind everyone that F&M students get first priority, and everyone should please state your name and your affiliation.
I just gave you a big space. Come on. Hi.
My name's Catherine Kistler. I'm a sophomore here. And I was just wondering about the more specifics of your actual work with autism itself. So do you give that digestive enzyme to your patients and it causes them to reduce the characteristics of autism? Or I don't know, what was the results of your work?
So we brought it through a phase 3 clinical trial with FDA. And so, and we have outcome measures that we use to measure its effectiveness, right? And so what we're looking at is change in behavior, because that's the main symptoms. So irritability, socialization, all of those kinds of things. So you put it through that rigorous double-blind process, and that's what we just completed in one phase 3 and had good results. And I think the basis of that is that the digestive enzyme, this particular digestive enzyme, actually breaks apart the protein into its amino acids, but the part that this particular enzyme does forms the basis of serotonin and dopamine. And as a result of that, changes the amino acid pool for these kids, and I think that's what's underlying that. And that's the basic premise, is that it comes from that piece, or at least part of it. What we found was about 2/3 of the kids actually have this deficiency. And so it's not all the children, and autism is a big spectrum, right? And just like depression, lots of things can cause it. There are certain things can treat it better than others, and depending on who you are and what caused it. But I think that for at least a group of these children, this will be helpful.
Thank you very much.
You're welcome. That's okay. Carpe diem.
Carol Kornhauser from the library. So again, following her question, there seems to be so many more children now with autism than there used to seem to be, correct?
Right.
So is that lack of enzyme in their body something environmental, or is somebody trying to figure out where that comes from? I know that it's talked about a lot, but do you think that's somehow linked? And if it is, why?
Right, well, that's the big question.
Okay.
Actually, it's a great question. It's a question that we grapple with all the time. Why does that exist in these kids? And does it develop, is it at birth? Does it develop over time? And is it genetic? Is it environmental? What is it? We also know that these amino acids that are broken off by this enzyme actually turn on and off specific genes. And that's, in the last 15 years, that's new science. So certainly after we started this project. So we're not sure, but we're doing more work to look at that and to decide or try to figure out whether there's a genetic basis for that, or whether there's an environmental basis for that, whether the children actually have altered gut flora and that gut flora actually destroys the enzyme, or whether there's a pre-programmed reduction of flow of the enzyme. We don't know. It's a big question. But in medicine, a lot of things have been embraced over time, like people have thyroid deficiencies. People aren't really looking at why they have thyroid deficiencies. We kind of know that some of them are genetic and others are not, but why does that happen? We just give Synthroid, right? You just give drug, and it replaces it, and it's helpful because when you don't have it and you need it, so the FDA is not necessarily concerned with exactly how that works. They're more concerned with if does it work, and we're trying to figure out why it works. So we're in that process. It's a very exciting scientific discovery. But the whole thing is sort of backwards from the way that drugs have been discovered in the past. I mean, way back when, you figured out that, someone was missing something, you give it. But now, in the years, the last 30, 40 years, drugs were developed by looking at a novel compound that's patentable and looking how it works and then retrofitting it back into a disease. And indeed, that whole model has now stopped working. And most of these big pharmas have done away with their R&D because that whole thing's not working, and they're looking to companies like ours and other companies, and also now looking at the patients, which is where really all begins. You're welcome.
Thank you for your wonderful talk. My name is Michael Penn. I'm in the psychology department. I was wondering if you could say a little bit about how the clinical picture of these autistic children changes as a result of the intervention. Can you say a little bit about what you see, what differences develop as a consequence of the treatment?
Well, I can only do it in terms of what the study has shown, and we're in the process of publishing papers and things about that. But it's the quality of their life and how all their symptomatology. Right now, there are 2 drugs approved for autism, which are adjunct drugs, risperidone and abilify, and they're antipsychotics to reduce irritability. They don't address the autism. They address the irritability associated with the autism. We're hoping that and I have to say it that way because that's what we're working on it, right? It's not approved. And so we're hoping to affect the core symptoms, the socialization, the speech, those kinds of things for the autism. And we can talk about that more together.
Hi, my name's Jenny DC, and I'm a first year here at Franklin and Marshall. Then I guess that I'm like you in some ways, that I have my own disruption, that I have really cool idea for. Do you have any tips for young people wishing to take their research to the next level?
In what area?
With neurology.
Okay, so I think that there's a process, and what you hope for it to do, right? So in what we did, I never thought about this becoming a company and becoming a drug for children. It was just something that I looked at, right? So I didn't have the focus of taking a molecule, retrofitting it, and trying to treat a disease, because I wasn't in that business. So it became a stepwise process for me. So, I did my TED Talk here, and I talked a little bit about it, about how my brother said to me, "What's new?" I said, "I found this really cool thing with these kids." I told him, and he said, "You should patent that." And I said, "That's a ridiculous notion for me to be patenting things." And he said, No, because if you want it to be meaningful, that may be a way to have a commercial value to it, and the kids will get it. So we can talk about that a little bit, but there's multiple different ways in terms of doing that, and I would implore you you're a first year, so I'd implore you to find, a mentor here who can maybe help shepherd that into something that can help people who you're trying to help. But I think there's a lot of different ways to do that, and we can talk about that even offline. But I think that putting it out there, exploring it, understanding it, and then taking it to the outside world is a whole different story, right? That's what you're talking about, right?
Right.
Yeah, that's a whole
Well,
different
just
story.
anywhere, getting
And how you
started
protect
anywhere.
it and what you do with it. And if you publish it first and then you patent it, you can't patent it after you publish it. So there's a whole bunch of things like that. And but hopefully we can bring that to the institution too.
Sorry, thank you.
Thank you.
Hi, I'm Clark McSparron, class of 1955. I've been a practicing pediatrician for 52 years, and in my slow down years, I'm 8 hours a week downtown at 2 inner city schools, where the bricks include poverty, autism, attention deficit, poverty, and my present disruption is the number of kids, and I ask, can I talk with your dad about this or your mom about this? And they use the term, no, he's incarcerated. Not in jail or in prison, he's incarcerated, which is a very harsh word. And I've read that the disruption of incarceration is perhaps even deeper than the disruption of a dad or a mom deserting the family or even of dying. Where are the spaces there between those bricks? What might be going on in the development?
Well, I think that there's a lot of research now around, people who are incarcerated, having a very high incidence of sort of mental disorders, whether that's ADHD, I'm going to use that as a mental disorder, but something neurologically not right. So there's a lot of drug use. A lot of people are incarcerated because of drug use, and whether that's self-medication or not. There's a lot of big pieces around that. I think that you bring up an area where the spaces are so big, what you're talking about, education and children and their lives, and the fact that there are a lot of single-parent families, and then you have the stigma of incarceration on top of that. That you really have, it's a big issue. And I think that there's a lot of shame, and around that comes a lot of other issues. So I think there's a whole cascade of places. And people try to stick holes, stick something to help in those places. But I think and you practice pediatrics for all that time, God bless you, it's a whole kid, right? It's about their whole life. It's about what they eat, it's about who loves them, it's about their education, it's about playtime, it's about all of those pieces. And how do you affect that one aspect? It's a really difficult question to do. And I'm a big proponent. I think that there should be pediatricians in every school, that the children's physical well-being needs to be taken care of. And if that was there, just like we have hot lunches in schools now, and in some places you take home something even, that if we had that, these children would be much better off, that their basic needs would be met. So you're talking about a place where there's big, big spaces. And I think some people in the educational world are trying to fill those spaces. But we tend to gravitate towards, a lot of education gravitates towards the gifted child, and not necessarily the child where, as they would say, there's talent, but there's not the nurturance that needs to happen. So I think you face a big space, but you must feel like your being there helps fill that space, doesn't it?
It does.
Yeah, it does.
Thank
Absolutely.
you. You're very empowering.
Thank you.
Thanks.
Thank you.
Hi, my name is Andrea Loman. I'm in the physics and astronomy department. I'm wondering if you can talk about how you've navigated resistance to your ideas. There must be people along the way who have been upset or who have said, that's not a good idea, or let's not do that, or why would we do that, or we do this, we don't do that. Can you talk about the choices you've made, because you have done it successfully, obviously, the choices you've made about how to navigate even people's feelings about changing the status quo as much as you have?
Do you have 2 days? Well, let's see. People, it's a challenge I face every day, right? And it gets easier as time goes on, partly because the science has caught up to us, right? And so we're talking about basically gut-brain, and that's like so foreign. And even though people have been screaming about it for a long time, like the last 10 years or so, about it with children with autism, nobody believed it, nobody funded it, nobody did anything about it. And Matt, who's here with me, who's my chief scientific officer, just before he got on here, just showed me that Autism Speaks is now investing $2.5 million in gut-brain connection. Right? So it takes a long time, even for when there's nothing else, for something to change that status quo. And they gave every existing drug in the world to these kids. Prozac, every SSRI, every stimulant that they have, and none of it worked for these kids. They've tried everything. They've tried new things. It didn't work. None of those clinical trials were successful because they're just trying to use the same old paradigm. There's something wrong in their brain. There's something wrong in their brain. Well, yeah, there may be something wrong in their brain, but they didn't look at it at the spaces. They just took the old thing and applied it to something new. And so you have to be fearless and develop sort of a thicker skin. I'm not a really good thick skin person, but you develop it a little bit. Having people like Matt with me, who's not a clinical scientist, but a real scientist, saying, this is right, this is right, this is right, this is right. What helped us was that I had 1,500 lab tests of these kids that showed me that this deficiency was real. So I could always fall back to that place, to the science. But I've heard people say, you're crazy. I've had people say to me, who were you to discover that? I've heard it all. I have heard everything you could possibly think of. But when it got right down to the nitty-gritty, and where I thought I would get the most resistance, I got the least, which was when I went out to the universities and said, I'd like you to be part of this clinical trial. And I thought, oh gosh, these psychiatrists were gonna go, what, are you kidding me? And they were like, no, actually, we've been watching these kids for a long time. And I think there might actually be something here, we're excited to do this. And so I had the people who were really in the trenches, look at this with me, who had no other agenda other than the kids, who looked at me and said, you know what, I'm gonna do this, I'm gonna do this. So there are moments like that when you seize those moments and say, okay, that gives me enough impetus to go forward. Because some days it's not great. A couple years ago, Entrepreneur Magazine asked me to do a video. They're doing this video series on places where entrepreneurs get their sort of respite. And mine, we filmed it at Yankee Stadium because I'm a big baseball person. But I said that, being an entrepreneur is like being a baseball player. You get up one day and you strike out 3 times, and the next day you get 3 hits. And if you let the 3 strikeouts affect you, you'll never get the 3 hits the next day. So you have to kind of just keep going with it and just understand that if you don't do that, you're going to have harder and harder time. The other night I spoke about culture, the culture you create. We have a fabulous work environment where people are happy, they're creative. I give them as many tools and as much room to be as creative as possible. And that really makes a difference because people like to come to work every day because they work really hard. And, but it was difficult. As I said, the science is now caught up. Everyone wants to do microbiomes. But every single day, someone sends me an article from somewhere. What do you think about this? What do you think about that? Every sensational thing that you hear about for autism is way in the background. It's a long time to come. And the closer something is to being real, the less it's talked about. It's the media, because they can. We can't talk a lot about our phase 3 because it's an FDA process, and we can't do that. And I understand why, because you don't want to make something real until it's actually approvable for the kids. And so it's a great question. It's been a really difficult time, very hard when you're trying to get people who have one way of thinking, change that. But I think the world is better suited today for our drug than it was 5 years ago. And every time there's another step or a twist or a turn, I say, you know what, it's okay because it's getting me to where we need to go. And you have to have that piece. And I did a course during the summer at Columbia on leadership, and they talked about some new research that they have about entrepreneurs are the happiest people on earth. Because every time there's a new thing that they get to, it's a real boost. They're not going to the same job every day and not getting somewhere. They're always trying to get somewhere. And when you get further along, right? Then you have that next thing, like, okay, I can take that and go to the next piece. And you keep going and going and going and going and going. So it's been a challenge. There are places that I knew nothing about when I started this, like, how you raise money and put stock together. But that's what I had to learn and face those challenges for myself. And so, but you have to have the guts to just keep going and not listen to everybody and listen to everybody at the same time. I think it's a great question.
My name is Nazrin Ahmed, and I'm a senior. And so you've majored in the sciences when you were at F&M, and then you went on to pretty much become a doctor. And so your entire life was based on the sciences. And then along the way, you kind of implemented becoming a businesswoman. So you've thought you thought in the sciences for such a long time. And when you're used to thinking in a certain way for so long, and then you kind of change gears and you bring on this new way of thinking, to me, I think of that as sort of a disruption. So the business aspect coming into the sciences. So how did you adjust to the fact that you were thinking in the sciences but implementing the business aspect of it?
Okay, also a very good question. Being an entrepreneur and doing something like this is enormously disruptive to one's life. Okay, so my life became disrupted. I was very happy doing what I was doing. And the secret, or I think the key to success, is putting the people around you who think the right way. So I knew that I had to do this because I was going to face all of those things. And even if a big pharma bought it early on, they would just shelve it. They say, okay, get it out of the way. But I knew that if I was going to really do this, I had to learn something about doing a clinical trial. So I went back to school while I was still practicing to learn how to do clinical trial. So I did that. And I knew that I would have to do it so much because I knew the kids. So for example, when we started the clinical trial, our CRO, which is the people who run the trial, third party runs the trial, they said, Joan, you're never going to get a pediatric trial through FDA without blood test. And I said, oh, that's ridiculous. They said, no, I've never seen a pediatric trial without a blood test. You need to test their blood. And I said, well, there's no rationale for that. The enzyme's not absorbed. It doesn't do anything. The bloodstream doesn't even have anything to do with the enzyme. If there's a safety issue, it's in the gut, it's not in the blood. And they said, it's never going to happen. And I said, okay, well, if they ask us to do a blood test, we'll do it. But I didn't want to do a blood test because there's nothing worse than doing a blood test on a child with autism. Because if you're trying to measure how much calmer the child was because of your drug, and then they come in and you do a blood stick, forget that. So I knew that that would be disruptive to the trial. So FDA said, no, you don't need to do a blood test. There's no rationale for it. So what was to them the norm, there wasn't a rationale. So if I didn't think there was some really good reason to do something, we didn't do it. But I put lawyers and regulatory people and business people in a place where they could help us. And I didn't cut any corners there. Like I always say to entrepreneurs, if you're going to hire a lawyer, please hire a lawyer. Don't have your brother-in-law do it because he practices real estate law and you need regulatory law. It doesn't work. And the money you save, you'll end up spending later. So you have to have the right people, right? And I had a concept, and I fought with those people all the time. But the fact that they could fight with me about what they thought we should do and what I thought we should do, and then we came out with the right novel thinking but legal narrowness, was a good thing for the company. And I'm also the pediatric development person. So the thing that I know about a child is if a child is lagging behind in some area, if the lag is big, right, their prognosis is not as good as if a child develops slowly together. So that's what I did with the company. We brought the entire company along together so that I wasn't getting to the end of my trials and wanting to get a drug approved and I have a lousy patent portfolio. I'll never protect it, right? Or I have a great patent portfolio but I had a lousy regulatory. the people who did the study didn't do it right. So I had to make sure that, and I assumed I knew nothing. In fact, I said to our CRO one day, they would say one thing, then they would say another thing. This is before we even started the trial. And I said to them, you have to understand, this is like a blind person, me, and you move the furniture on me every week. And I trip right over the couch because you moved it into a different place. You have to tell me where it belongs, we'll put it there, and then I know there it is. So you have to have people that can work with you and can see your vision, but who have the right execution. Because I had a vision. I knew that the people who invested in me early, so what happens is in these kinds of companies, people come in early and they invest in you, they put a small amount of money, and people come in later, and they basically say, oh, forget all those early people. We're gonna like cram them down and we're gonna do all this stuff to them. And I said, no, I'm not gonna do that either. I told this big group that if they wanted to come in and invest in me, they had to do it on these terms, which was fair to everyone. So, and that's not how it's done. It's not done that way, Joan. I said, well, that's how I'm doing it. And if someone said, this is how it needs to be done regulatorily, I did it. I didn't question it, because those are the things, that's the box you have to work in. But in terms of how we got there and how I protected my people, that was different. And so you have to just keep going and moving forward and doing that.